Good, Barbara.
This is Town of Dayton Board of Health special meeting. We're at the Old Town Hall, 1111 Somerset Ave, Thursday, September 5th, 2024, 4:02 it looks like. This is also a remote participation Zoom meeting. It is a public meeting being recorded for cable broadcast and internet posting on YouTube at www.youtube.com/Town of Dayton. Should I say the Zoom meeting, Liz?
No.
Okay, that's all set then. I'd like to call this meeting to order. At this time, have the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. First in order, we should have the public health nurse interview. This evening, we're interviewing Karen Tripp. Karen, can you please come to the podium? We can have a talk with you. Can you tell us a little about yourself?
Yes. I've lived in Dayton for,
Excuse me, Karen. Does she have a microphone? Or can she have one? There you go.
I've lived in Dayton for over 30 years. I raised my family here. I've been a registered nurse since 1994. I've worked in various settings, hospital. I've had my own private practice here in Dayton. I've been primarily a psychiatric registered nurse and certified in psych and mental health for probably 25 years. I was at Morton for quite a few years, also Norwood Hospital. And I've recently left the hospital setting to restart my holistic practice here in Dayton. And I'm very interested in community health and preventative care and holistic care. And in the past, I worked with the Council on Aging, doing blood pressure clinics, the parish nurses actually. And I love the elderly. I've always worked with mostly dementia patients and mentally ill. And so I was interested in this position. So here I am.
Very good. We're going to start by asking you some questions, if you don't mind. Benny, would you like to start?
Sure.
Head this way.
So the first question is, tell us about yourself, your education, work experience, which I think you just did, and how you feel this has prepared you for the position of public health nurse for the town.
Well, as I said, I've worked with the elderly. I'm familiar with the Council on Aging. I've been a manager and a director, and also an educator within Stewart Healthcare and Morton Hospital before Stewart purchased it. And the combination of, my skills and education, I am familiar with the needs of the elderly. I know that's a big part of, this position. And, I certainly have a knowledge of infection control and the importance of, educating the public. So I thought that, I think that I have skills. I'm certainly open to learning anything that I need to know.
Great.
Does that answer your question?
Yes.
Please describe any past experience you have working with the local Board of Health or the Mass Department of Health.
I do not.
Okay, that's fine. Not everybody does.
I think I participated in a flu clinic with Dr. Hoy, Kelly Hoy, and then the volunteer work I did with the Council on Aging. I did some educational workshops, the blood pressure clinic.
Very good. Your turn.
How do you feel about working with our schools to adapt new programs such as CPR training for students?
I think that's a great idea.
Good, thank you.
Have you any experience with the MAVEN system, MAVEN, or disease reporting in the state of Massachusetts?
I do not, but I am somewhat familiar with what it is.
Okay.
We had an infection control nurse, at the hospital that took care of all that. But I'm willing to learn.
Familiarity.
Yeah.
Please give us an example of community health program you have developed, ran, or participated in.
I've done over at the Council on Aging, I did some education on dementia care, caring for the caregiver for family members who had family members that had dementia on how they can take care of themselves. Pretty much that's would be the focus of any trainings that I've done would be on prevention, caring for oneself, how to deal with dementia patients, that type of thing.
Thank you.
Would you have any difficulty implementing any local, state, or federal public health protocol that you don't agree with?
If it's a requirement, then I would move forward.
Thank you.
I know there are many regulations that have to be followed.
Okay. Can you provide any specific examples of recent work experience working with clients, elders? I know you said Council on Aging, and the general public and family.
What was the beginning of the question?
Can you provide specific examples of your recent experience working with clients, elders, the general public, and families?
So recent experience would be at the hospital.
Morton.
At Morton Hospital,
Mhm.
where I was the manager of the elder behavioral unit, which is 55 and older. And often I would have to work with the patients, the doctor, and the families, whether they had conflicts, questions, needed education, discharge planning. So often I would work with both the families and the patients
Mhm.
with their care, and their discharge plan.
Okay, great.
Do you have any relationships with local stakeholder or provider groups who you'd be able to call upon as a resource on behalf of Dayton residents as our public health nurse?
Do I have any?
Relationships. In other words, mentioned Dr. Hoy,
Yes,
and then you mentioned COA also.
yes, that's.
I know Dayton's a small town. It's not like we have a lot of big hospitals around.
Yeah, that's pretty much who I know.
I think we missed a question 8. I think we skipped that one.
I'll do 8.
Yes, would you do 8? please?
Sure.
I'm in a rush to get through this. I am so sorry.
That's okay.
It's been a long day.
Oh, sorry,
You can do it.
I'm sorry. Do you have any recent experience doing clinical work with patients such as immunizations and TB testing?
Recent, no. The staff nurses would give the immunizations. I would make sure that the patients received them and they were documented correctly, but actually giving them, no, not recently.
And you manage them.
Yes, I would manage them.
Okay, so this next question is, this position interfaces with the public frequently. What skills do you have that would enable you to effectively deal with residents on sensitive and confidential health matters?
So of course I would abide by confidentiality at all times. I'm a really good listener. I'm a good communicator, and I do very well in difficult and stressful situations, having been a psychiatric nurse and dealing with many different situations. And on a management and director level, I've had to deal with, as I said, families, doctors, nurse practitioners, and patients. So I'd be very comfortable with that.
Okay, thank you.
Have you had training and experience with emergency preparedness? Describe the situation and your role.
So as a nurse, we're all trained in emergency preparedness. And basically, if there was any type of medical emergency or psychiatric emergency, I would make sure that everything was in place, the staff, that things flowed the way they were supposed to when the doctors and emergency teams would come to the floor. So basically, I would oversee any emergencies. Dealing with psychiatric emergencies, I would often be the de-escalator. I was the de-escalation trainer for many years on teaching staff how to work with patients during, escalation. And so I've been in both medical and psychiatric emergencies.
Thank you.
As you probably noticed in the job description, this position is a part-time per diem role. What kinds of flexibility do you have to accommodate the needs of the position?
So presently my schedule is flexible. I'm going to be opening my own practice this month, the middle of this month. And so the hours, I'd be very flexible in making the hours work for both our jobs.
And I skipped 12. I'm sorry.
That's okay. I'll do 12. So what have you done in previous positions to help establish and maintain quality customer service within your organization or department?
So that was a really big part of being a director and a manager, working with the multidisciplinary team, with leadership, to keeping track of quality initiatives, implementing quality initiatives, doing surveys with patients and their families. So that was an ongoing part of my role to assure that both patients and families were happy with the care.
Great, thank you.
Why do you feel you are the best candidate for this position?
Well, I feel like I have well-rounded skills working with different age groups and populations. And as I said before, I'm very community-minded, holistically focused, and prevention-focused. I think that's important in community health, and I love to educate.
I have one other one before the last one, please.
Sure.
Can you describe your practice you're talking about opening?
Yes, so I'm also a licensed massage therapist and a clinical aromatherapist and an educator, as I've said. So my goal, I had a practice probably 20 years ago before I was full-time in the hospital. And so my goal is to reopen. It primarily focuses on women's wellness. I'll be teaching classes, in-home as well as out in the community, hopefully in hospital settings, and also have private clients using body work as well as aromatherapy. And really the focus would be on stress management and wellness.
You're in a perfect location, stress management.
Yeah.
You're perfect.
Can
Wow.
I ask a follow-up question?
Yes, of course.
Yeah, part of the job description is, do you have your own malpractice insurance?
Yes, I do.
You do, okay, great. That was it.
Okay, do you have any questions for us?
Hours. I know it says per diem.
Mhm.
So do the hours vary based on the needs, week to week?
That's exactly what it is. We can work things out where you should be going. And we'd like a lot of input from you also. This isn't a one-way thing here. You're the town
Regarding the needs of the,
Mhm. of the COA, or if we have any vaccinations going on. I know the fire department's been doing quite a few. But between Lincoln Village and the COA, we have quite a few elders. But I'd also like to start something where you start looking in homebound.
Mhm.
I know a lot of nurses go into the home, they're paid by the insurance or whatever, but I'd like to know, keep an eye on the ones that are there. As I was talking to you previously about that elderly man that no one knew he was there. He felt 12 hours. He actually, his son would come from New Bedford to bring him food because he didn't have food. He was kind of not a recluse, but he didn't want to bother anybody. Those are the people I'd like to keep an eye on. Maybe, the COA could probably help you with that, or if townspeople know of anybody that needs to be checked on. I think that's a big part of the town nurse. They have a lot of other individuals in health-oriented Medicare that would come in and check. But sometimes they slip through the cracks, and we have to find those people, because I felt really, really bad that we had let that poor man down.
Mhm.
And I think that's a big thing that we've got to look at. But it's per diem. There's a lot of outreach to it. The Cow Chip Festival, we've had tents there and had outreach. There are a couple other big things going on in town that the nurse usually participates in. It's a very, very, very varied job that you will never be bored at. Never. It's really a good one.
And you had mentioned working with the school nurse.
Yes, I've already talked to her. My big thing is CPR. I really see that as a goal. I know it's a little confusing with Dayton Rehoboth up at the high school, but with the elementary, it's kind of young to teach them, but middle school. And we all certainly know that CPR is so important. And I think there's something else that's fallen through the cracks. These students are going through high school and they're learning a lot. But in day-to-day life, one thing they should all have is CPR training. You never, ever know when you can need it. And as I said before, I don't know CPR. And God forbid, if somebody I love gets hurt and I don't know how to help them, I don't know how I'd live with myself, because I haven't taken CPR.
I have.
So good, you can say. Although
30 and 2.
Although Liz, a couple times I've said, Liz, watch out, if I start slipping off the chair, call 911. But I think that's a big part that's really slipped right through the school. So we're talking about that. I'd like interaction between the nurses in our town. We're all serving the town.
Right.
Everybody in this room is serving the town, and we want what's best for the town.
And then I noticed that there would always be like a letter from the town nurse in the Council on Aging newsletter.
We'd love to reenact that if you'd like to do that. I'm pretty sure they would also.
And I would think in the role you work closely with the Council on Aging as well.
Yes, definitely.
And then any needs that they might have, or education that they need for.
That would be fantastic. Plus you can bring a guitar.
How about that?
I know a lot about everybody. We have a mutual friend.
Oh, we do.
Yes. But we probably have a lot of mutual friends, honestly. It's a small town. It's a small town. Okay, dear, are you, anything else you'd like to ask us?
No, nothing that I can think of. If I think of something, I'll call. Or if you do.
Yeah. Okay.
Great.
Thank you.
Thank you so much, honey. It was enjoyable. Okay. Discussion on the nurse. Anybody have anything to add?
I think she's wonderful.
I thought looking over her resume, her experience, I thought she was a very strong candidate.
Wow.
And it was like, why
Experience.
you applied for this job?
Well,
She
I
was,
think because she has her own business she's open, which I love the holistic approach.
yeah,
Absolutely.
Oh, yes, yes. And what I like about her is the program she's been in, I think we can really use and work through with the police department also
Absolutely.
when they need it, you know? It's wide range, very
Yeah,
wide
she-
range.
I like her management experience.
Yes.
Director
absolutely.
experience.
You can stay, we're talking about you.
We're talking about you.
Stay.
It's all good. You can stay. You know,
Her
how-
personality,
Okay.
she's not shy, she's very,
exactly.
personable,
Yeah.
Yes,
which is needed in that
but
position.
professional.
But professional,
And you
absolutely.
can tell that what she talked about as far as like when you're managing people with different personalities, people with,
Absolutely,
and how to handle all of that.
Yes.
So I thought she was,
yes,
looking over her resume and everything, I thought she was extremely strong.
absolutely.
I would definitely recommend,
I agree with you.
definitely.
Same here.
Okay.
Highly recommend.
Yeah.
Would we like to vote on this?
Yes.
Okay. Can I have a motion
I motion
to?
to recommend Karen Tripp to the town selectmen.
There you go. Great.
Second,
Okay, and we have already had the discussion, so can I have a vote on it?
Aye.
aye.
It is unanimous to recommend Karen Tripp to the selectmen as our choice for town nurse. Very happily.
Absolutely.
What do you think, Karen?
I think she's very qualified for what you.
I think she's very qualified too. I think
Extremely qualified. Yeah.
extremely.
Except I don't know why she applied. She's like,
Stop it.
she's very, very good.
Stop it.
Something else, I don't want to get too off topic.
No, that's all right.
Too far away, but when she was talking about some of her experience, you know what I would love to see in this town? And I have one at home, is the life vac for choking.
Right.
I would love to
Yeah.
see some in the town, maybe at the schools or, any community centers we have. I don't know how the police department, I'm not sure if they would
Mhm.
need to be, insured, but I'd love to see them on the fire trucks, some of the police cars. They've really saved some lives. And like I
Great
said,
idea.
I have one at home because there's a baby in the house. So, and it doesn't mean that it's just for babies. Yeah, adults choke too.
That's part of to Barbara's point, that's part of the CPR training. So they teach you, like, if it's a baby, how to do CPR, you flip the baby over, you don't do the compressions, you do that. That's all part of like CPR training, which, to your point, Barbara, I think that doing that through the schools is extremely important. And it doesn't matter what age, it makes no difference.
Right.
If you,
Yeah.
having that awareness and having them doing that I think is a big.
The only thing is, they don't teach that in CPR training. The life, are you familiar with LifeVac? It's an actual piece of equipment, and it's like a suction.
Oh, no, they didn't do that.
It's amazing. It's absolutely amazing. It pulls it
Does it?
right out. The suction just takes it right out.
Is it
So-
the one they show on TV?
Yes. So I'm not really sure if the fire department or the police department has to have any type of special insurance because of.
It's all like, I think it's under the Samaritan law.
They would have to.
I think under the Samaritan law, it doesn't matter.
Right.
Yeah.
And maybe we could go with that, what is it? The Bristol County Nursing?
Mhm.
MHOA.
Yes, yes. Maybe we'll contact them. She could because she'll be taking over that position
Yeah.
anyway,
Mhm.
if she gets
Right,
voted in.
sure.
She could do that and we can look into grants.
Mhm.
See, there you go. There's one for
There's
you.
one.
A new grant man here. Yeah,
Perfect.
how's that? There's one
Sounds
for
good.
you. Look into that one. Put
Mhm.
that one down first. We're gonna have a long list for you, kiddo.
Send it to me. Send it to me and I can look into it. I've
Awesome.
done them before.
Awesome.
Yeah.
Great.
They can be a painful experience, but sometimes they're not so bad, but sometimes they can be involved and they can be lengthy
Yes.
It can take a while to get them. But the thing with grants is you need to apply. So if the grant is 18 months from now, it's like,
Right.
you need to do it now, you
Right,
know, and
right.
maybe you'll get it. But as you know, probably is like that grant money comes and goes,
Yep,
you know, so you gotta jump on it and get it
exactly.
as quickly as you can, you know, because you'll lose it. Right. So,
That's the thing,
Absolutely.
yeah, it really, we don't have a per se grant writer in town. So that's why, as the Board of Health, we have to go out and we're going to find our own.
I think that's a great
Yeah,
idea.
there are a lot of things, outreach that we have to do in this town,
Mhm.
and we need money to do it, and we can't be asking the residents for every dollar they have. That's,
because that was one of the things that I asked Barbara when I came in, is because when you look at the Board of Health, when you looked at the position, and it was like, you need this training, you need this training.
mhm,
Some of those trainings are money, it costs money.
Right,
Like the ICS 100, I already started to take that like last night. That's free, that's through FEMA, that's fine.
right,
But some of the other ones are like $400 more, you know, in order to get those trainings. And if we don't have the money,
exactly,
we can't take them.
yeah.
right,
But if we can get a grant
right.
somehow, some way,
Yeah,
They're
yeah.
out there, there are Board of Health grants out there.
yeah.
I've been looking into them, but I only have so many hours a day.
Yeah, because
Sorry,
it wouldn't be, I don't think it would put us in a good position to say, oh, do you have that training? It's like, no. How come? Because we don't have the money.
Right,
Right?
right.
It makes us look bad.
Let's look for it. Let's look for it. We've got a lot of things on our plate, a lot of things, but we've got a lot of ideas. And as you guys know, if you got your ideas, don't be afraid to say them.
Mhm.
That's the only way we can get this board
Right.
up and running and be competitive with other towns and be a really strong board for our residents.
Do we ever do anything with other towns, like meet with other town Board of Health, see what they're up to, see what they're doing?
Not really, not really.
Would that be a good idea?
Yeah, that'd be a great idea.
What's the city of Taunton doing? What's Somerset doing?
Any
Yeah,
type of, any
Taunton's
type
kind
of
of a different
networking.
level than us, but during COVID, we did work with a couple, you know, with the nurses, actually the nurse, I know her very well.
Yeah. Maybe they give us an idea of like what grants are they applying for, you know?
Right, right, there you go. That would be great.
Sounds good.
Something like that.
Absolutely.
Anything else?
No,
You sure?
that's it. No, I'm
Okay.
glad. I wanted to ask that. And it's been in the back of my mind, actually, all
Yeah,
summer.
don't
And when I
ever-
got one for the house, I think they're so fantastic.
Don't, you know, because we really have to look outward. I mean, the year is 2024. It's not 1919. There are new things out there for us to go
Mhm.
with. And try to get as many grants as we can so we can
Yeah.
learn about
Like
everything.
I said, Barbara, just email me. Is this anything that you think that, or in anything that you can have, anything that you think we should have? And if there's links to it, great. If not, I can search and I can find.
Okay,
And, you know, even if it's just a generality and you say, hey, there's, what do we, you know, CPR training and maybe there's something with the state. I can dig through and I can find out. You know, that's easy enough to do, right?
and the other thing is we're in process of getting our town administrator and working with him also because he's on a grant level.
Mhm.
So working, or her, him or her, I'm not sure if there are any ladies coming in, but that would be a great hookup right there,
Mhm.
is working with them, with
Sure.
him or her, whoever's coming.
Yep.
We'll be working on that next
Well,
week.
even if they, if they decide that they're going to do the grants, at least you can do some of the back work
Exactly,
and send that to them and say, this is what we found. Here you go.
exactly.
Go to town, right?
Right.
So,
Yeah, I think that's a great idea. I think a lot of boards should be doing that researching.
mhm.
I mean, there's a lot of money out there and why not? If we don't, somebody else is going to use it.
Use it or lose it.
That's right.
Yeah. So like I said, shoot me an email. You have my
Yep.
personal email address. Send it to me.
Have you got the town email yet? Are you listed on
Not
it
yet.
yet?
Not yet.
Waiting for IT,
He was here today, Chris.
was he?
Yeah. When you were out on your clock.
Yeah, I don't care. To me, it's like, just send it to my, you have my personal email. Just send it to me. I don't care.
Okay.
Doesn't matter to me.
For now, we'll work it that way. Okay, let's go on. Reorganize the board. We have to assign a clerk and a member. So can I have a nomination for clerk of Board of Health?
You looking at me?
Yeah,
Okay, I'll do.
no, I mean, could you,
Oh, I would nominate Tim.
okay. I'll drop down and second that motion. Can I have a vote on this?
Aye.
Aye.
I drop down, vote aye, and motion passes. Tammy Mello as clerk. And do we do member also, Liz? Or is that just a given? It says clerk and member.
Yeah, just do member as well.
Okay. Can I have a nomination for a member of Board of Health?
I motion.
I second that motion. Could we have a vote on that?
Aye.
Aye, motion passes. Penny,
Mhm.
you're our member.
Okay, good. That's nice to know.
I know, huh? Woo-hoo. New business, review, discuss, act, accounting signature authorization form. Liz, do you have that?
Yeah, so this is just for accounting purposes, payroll and bills. Somebody needs to be the primary signature and somebody needs to be the secondary. I wasn't sure who was gonna be who, so I made one. Who could be more available to come in and sign payroll? I know will be the primary, so
I would give Tammy if you want to do it.
Tammy.
I'm right down the street.
So just make a motion to nominate Barbara as primary and Tammy as the alternate.
I make the motion.
I drop down and second it. Can we have a vote?
Aye.
Aye.
Aye. Okay. This is just a bookwork meeting,
Mhm.
you know, just catching up. Thank goodness we don't have anybody else out there. No problems.
I said that, Tammy, because I don't know what your availability is, but mine might be,
Available.
mine might be a little sketchy sometimes.
I never really. go
Unless
anywhere,
Tammy's
so-
fixing a horse somewhere or
Yeah,
something.
or trying to ride a bike.
That's the only reason. I wasn't trying to just point the finger or anything like that.
That's right. You- What happened to that bicycle?
I gave it away. I got a bicycle and I got on it in my driveway and I haven't ridden a bike in years. And I nearly killed myself. So I said, I got to give this bike away. I'm going to stick to riding horses.
They're not any more dangerous, right?
Yeah, way more dangerous.
Yeah, well. Okay, since we've done all this really important stuff tonight, can I have a motion to adjourn?
Second. Motion.
I second.
Okay, that's great. Can I have a vote?
Aye.
Aye.
Motion carries to adjourn. Good night, everyone. I
Good
hope
night.
you enjoyed our meeting tonight.
I did.
Oh, come on, the last, the other